Look down at your ankles right now. Are they puffy? Swollen? Do they look bigger in the evening than they did in the morning? When you press your finger into the skin above your ankle bone and hold it there for a few seconds, does it leave an indent that takes time to fill back in? If you answered yes to any of these questions, I need you to pay very close attention to what I'm about to tell you, because that swelling in your ankles might not be what you think it is. You've probably been told it's just a normal part of aging. You've probably heard that everyone gets puffy ankles when they get older. You've probably been advised to elevate your feet, reduce your salt intake, and not worry about it too much. And maybe that advice is correct for your situation. Maybe your ankle swelling really is benign, caused by something as simple as sitting too long or eating a salty meal. But maybe it's not. Maybe that swelling is your body sending you an urgent message. A message that your heart is struggling. A message that something is going wrong inside your cardiovascular system. A message that, if ignored, could lead to serious consequences. Ankle swelling, medically known as peripheral edema, is one of the earliest and most visible warning signs of heart failure. It can appear months or even years before more dramatic symptoms like severe shortness of breath or chest pain. It's your body's way of telling you that your heart isn't pumping blood as effectively as it should. But here's the tragedy. This warning sign is routinely dismissed. Patients mention it to their doctors and are told it's nothing to worry about. They notice it themselves and assume it's just what happens when you get older. The signal is there, but nobody is paying attention to it. By the time more obvious heart failure symptoms develop, by the time breathlessness becomes severe or fluid accumulates in the lungs, significant damage has often already occurred. The opportunity for early intervention has been missed. I don't want that to happen to you. By the end of this video, you're going to understand exactly why ankle swelling happens when the heart is struggling. You're going to learn how to distinguish cardiac edema from other causes of swollen ankles. You're going to know what symptoms should prompt immediate medical attention. And you're going to have a clear action plan for what to do if you suspect your swelling might be related to your heart. This information could save your life, or it could save the life of someone you love. Please watch until the end. Let me start by telling you about a man whose story illustrates exactly how this warning sign gets missed and what happens when it's finally recognized. He was 68 years old, a retired accountant, generally healthy throughout his life. He'd never had any serious medical problems. He took medication for mildly elevated blood pressure, which was well controlled. He had a physical exam every year and always got a clean bill of health. About 2 years before I met him, he started noticing that his ankles were puffy by the end of the day. Not dramatically swollen, just noticeably fuller than they used to be. His socks left deeper indentations in his skin. His shoes felt tighter in the evening. He mentioned this to his doctor at his next annual checkup. The doctor glanced at his ankles, noted mild edema, and reassured him. "That's very common as we age," the doctor said. "Your circulation isn't as efficient as it used to be. Try to elevate your feet when you're sitting. Cut back on salt. It's nothing to be concerned about." He followed the advice. He propped his feet up while watching television in the evening. He reduced his sodium intake. The swelling would go down overnight and return by evening, but it didn't seem to be getting worse. He stopped thinking about it. Over the following year, subtle changes occurred that he didn't connect to the ankle swelling. He found himself getting tired more easily. Activities that had never winded him before, like climbing the stairs to his bedroom or walking from the far end of a parking lot, now left him slightly breathless. He assumed this was just deconditioning. He'd been less active since retirement. He was getting older. These things happened. He started sleeping with an extra pillow because he felt more comfortable with his head elevated. He didn't think much of it. Maybe he was developing acid reflux. Lots of people his age had that. He had to get up more often during the night to urinate. Again, he attributed this to age. Prostate issues were common in men his age. His appetite decreased somewhat. Food didn't taste as appealing as it used to. He lost a few pounds without trying. He figured his metabolism was just slowing down with age. Each of these symptoms, taken individually, seemed explainable by normal aging. None of them was dramatic enough to prompt a doctor's visit. None of them seemed connected to the others. Then, about 18 months after he first noticed the ankle swelling, something happened that couldn't be ignored. He woke up in the middle of the night, unable to breathe. Not slightly short of breath. Genuinely unable to get enough air. He felt like he was drowning while lying in his own bed. He sat bolt upright and dangled his feet over the edge of the bed. Slowly, over the next several minutes, his breathing eased. The sensation of drowning subsided, but he was terrified. His wife insisted they go to the emergency room. The doctors there performed tests and delivered devastating news. He was in heart failure. His heart had been weakening for some time, probably years. Fluid had accumulated in his lungs, which was why he woke up feeling like he was drowning. His heart was pumping at a fraction of its normal capacity. Looking back, the doctors said, there were warning signs that had been present for a long time. The ankle swelling was likely the first visible indicator. The fatigue, the breathlessness with exertion, the need to sleep propped up, the nighttime urination, the decreased appetite, all of these were classic symptoms of progressive heart failure that had been attributed to normal aging. If the ankle swelling had been investigated properly when it first appeared, if someone had considered that a 68-year-old man with new-onset edema might be developing heart problems, the diagnosis could have been made much earlier. Treatment could have started sooner. The progression might have been slowed or even partially reversed. Instead, 2 years of warning signs were missed. 2 years during which his heart continued to weaken. 2 years during which intervention could have made a difference, but didn't happen because everyone assumed his symptoms were just part of getting older. He survived that acute episode. He was hospitalized, treated aggressively, stabilized. But his heart had been damaged. His pumping function was significantly impaired. He would live with heart failure for the rest of his life, managing symptoms with multiple medications, careful fluid restriction, and regular monitoring. He was fortunate that he survived the crisis that finally brought him to medical attention. Many people with their first acute heart failure episode don't survive. Their hearts simply can't handle the stress. They die without ever knowing their heart was failing until it was too late. This man's story is not unusual. I've seen variations of it countless times. Patients whose ankle swelling was dismissed for months or years. Patients whose gradually worsening symptoms were attributed to aging until something dramatic forced a proper evaluation. Patients who lost precious time for intervention because nobody took their early warning signs seriously. I want to change this pattern. I want you to understand what ankle swelling can mean so that you or someone you love doesn't become another story of misdiagnosis. Let me explain exactly what happens in your body when your heart starts to struggle and why that struggle shows up as swelling in your ankles. Your heart is a pump. Its job is to circulate blood throughout your entire body, delivering oxygen and nutrients to every cell and carrying away waste products. It beats roughly 100,000 times every day, pumping thousands of liters of blood through your circulatory system without rest, without breaks, for your entire life. When your heart is healthy and strong, it pumps blood efficiently. Blood flows out through your arteries, delivers its cargo to your tissues, returns through your veins, and cycles back through your heart and lungs to pick up more oxygen before starting the journey again. This system works beautifully when everything is functioning properly. But when your heart begins to weaken, when it can't pump as effectively as it should, problems develop. A weakened heart can't push blood forward as efficiently. Blood doesn't circulate as briskly as it should. And importantly for our discussion, blood returning to the heart through the veins can begin to back up. Think of your circulatory system like a complex plumbing network with the heart as the central pump. If that pump weakens, it can't pull water through the pipes as effectively. Water starts to back up in the pipes leading to the pump. Pressure builds up in those backed up pipes. In your body, when blood backs up in the venous system, pressure in the veins increases. This elevated venous pressure forces fluid out of your blood vessels and into the surrounding tissues. This escaped fluid is what causes swelling. Why does this swelling appear in the ankles first and most prominently? Gravity. Your ankles are at the lowest point of your body when you're upright. Gravity pulls blood and fluid downward. When you're standing or sitting with your feet down, the blood in the veins of your legs has to fight against gravity to return to your heart. Even with healthy circulation, this is challenging. Your leg veins have one-way valves that help push blood upward, and your calf muscles act as pumps when you walk, squeezing veins and pushing blood back toward your heart. But when the heart is weak and venous pressure is elevated, these mechanisms can't compensate adequately. Fluid accumulates in the lowest areas because that's where gravitational pressure is greatest. Your ankles and feet swell first and most noticeably. This is why cardiac edema typically worsens throughout the day as you spend time upright and improves overnight when you're lying down and gravity is no longer pulling fluid into your legs. In the horizontal position, fluid redistributes more evenly and some of it can be reabsorbed into the bloodstream and eventually eliminated by the kidneys. This pattern of daytime worsening and overnight improvement is actually an important diagnostic clue. Swelling that follows this pattern is more likely to be related to cardiac or circulatory causes than swelling that remains constant regardless of position. As heart failure progresses, the swelling tends to extend beyond the ankles. It climbs up the legs, affecting the calves and eventually the thighs. In advanced cases, fluid can accumulate in the abdomen, a condition called ascites. It can accumulate around the lungs, making breathing difficult. It can even accumulate in other parts of the body. But in the early stages, it's often just the ankles. Just some puffiness at the end of the day. Just socks leaving marks. Just shoes fitting tighter than they used to. It looks so innocent. So easily dismissible. So much like what everyone says happens when you get older. But it's not innocent. It's a signal. It's your body telling you that something is wrong with the central pump that keeps you alive. Now I need to explain something important. Not all ankle swelling is caused by heart problems. There are many potential causes of edema, and determining the right diagnosis requires careful evaluation. Let me walk you through the major causes of ankle swelling so you can understand the possibilities. One common cause is venous insufficiency. The veins in your legs have valves that prevent blood from flowing backward. When these valves become damaged or weakened, blood can pool in the leg veins instead of returning efficiently to the heart. This venous pooling increases pressure in the leg veins and causes fluid to leak into the tissues, producing swelling. Venous insufficiency is common in older adults and can cause swelling that looks very similar to cardiac edema. The swelling typically worsens with prolonged standing or sitting and improves with elevation. It may be associated with visible varicose veins, skin discoloration on the lower legs, or a history of blood clots in the leg veins. While venous insufficiency is not the same as heart failure, it's not necessarily a benign finding either. Severe venous insufficiency can cause significant problems including skin breakdown and ulcers. It deserves proper evaluation and management. Another common cause is medication side effects. Many commonly prescribed medications can cause ankle swelling as a side effect. Calcium channel blockers, which are frequently used for high blood pressure and heart conditions, are notorious for causing ankle swelling. Amlodipine is probably the most common culprit, but other drugs in this class can cause edema as well. Certain diabetes medications, particularly the thiazolidinediones like pioglitazone, cause fluid retention and swelling. Nonsteroidal anti-inflammatory drugs like ibuprofen and naproxen can cause fluid retention, especially with regular use. Some blood pressure medications, steroid medications, certain antidepressants, and various other drugs can contribute to edema. If you've recently started a new medication and noticed new ankle swelling, there may be a connection worth discussing with your doctor. However, don't simply assume that medication is the cause without proper evaluation. Heart failure can develop coincidentally around the same time a medication is started, and dismissing the swelling as a drug side effect could delay a critical diagnosis. Kidney disease is another cause of ankle swelling. When kidneys aren't functioning properly, they can't eliminate sodium and water as effectively as they should. Fluid accumulates in the body, and because of gravity, it tends to show up as swelling in the legs and ankles. Kidney disease can exist alongside heart disease, and the two conditions can worsen each other. The heart and kidneys have a close physiological relationship. When one struggles, the other often struggles too. Liver disease can cause swelling, though the pattern is somewhat different. Advanced liver disease often causes fluid accumulation in the abdomen first, with leg swelling coming later. The mechanism involves decreased protein production by the damaged liver, which affects fluid balance throughout the body. Sitting or standing for prolonged periods can cause temporary ankle swelling even in people with healthy hearts. Long flights, long car rides, or jobs requiring extended standing can all produce dependent edema simply because blood pools in the legs when they're not moving. This type of swelling is typically mild, improves quickly with movement and elevation, and doesn't progress over time. It's fundamentally different from the persistent, worsening edema of heart failure, but it can be confused with early cardiac edema if not evaluated carefully. Pregnancy commonly causes ankle swelling due to hormonal changes, increased blood volume, and pressure from the growing uterus on pelvic veins. However, sudden or severe swelling during pregnancy can indicate serious problems like preeclampsia and requires immediate medical attention. Lymphedema occurs when the lymphatic system, which normally helps drain fluid from tissues, is damaged or blocked. This can result from surgery, radiation treatment, infection, or rarely, inherited conditions. Lymphedema tends to cause swelling that doesn't pit as easily when pressed and doesn't follow the typical day-night pattern of cardiac edema. Infections in the legs, including cellulitis, can cause swelling along with redness, warmth, and pain. Blood clots in the leg veins, called deep vein thrombosis, can cause swelling usually in one leg more than the other, often with pain and warmth in the affected area. With all these potential causes, how can you distinguish cardiac edema from other types of swelling? There are several clues that suggest ankle swelling might be related to the heart. First, consider the pattern. Cardiac edema typically affects both legs roughly equally. If swelling is dramatically worse in one leg than the other, that suggests something other than heart failure, possibly a blood clot or localized venous problem. Cardiac edema typically follows the gravitational pattern I described. Worse at the end of the day after being upright, better in the morning after lying down all night. It pits easily when you press on it, meaning you can push a finger into the swollen tissue and it leaves a temporary indent. Second, consider associated symptoms. Cardiac edema rarely occurs in complete isolation. If your heart is struggling enough to cause ankle swelling, there are usually other signs as well. Do you get short of breath more easily than you used to? Does climbing stairs or walking up hills leave you winded when it didn't before? Do you need to stop and rest during activities that used to be easy? Do you feel unusually tired? Not just sleepy, but genuinely fatigued in a way that doesn't improve with rest? Do you need to sleep propped up on pillows? Have you started elevating the head of your bed or found that you're more comfortable in a recliner than lying flat? Do you wake up at night short of breath? This symptom, called paroxysmal nocturnal dyspnea, is particularly characteristic of heart failure. When you lie down, fluid that was in your legs during the day redistributes into your chest cavity. In someone with a weak heart, this can cause fluid to back up into the lungs, producing the sensation of breathlessness or drowning that forces you to sit up. Do you have to urinate frequently at night? When you lie down, the fluid in your legs returns to your circulation and eventually gets filtered by your kidneys and eliminated as urine. Increased nighttime urination can be a sign of daytime fluid accumulation. Have you gained weight recently without eating more? Fluid retention causes weight gain that can be significant. People with worsening heart failure can gain several pounds over just a few days from fluid alone. Has your appetite decreased? Heart failure can cause loss of appetite and nausea because fluid accumulation affects the digestive system. If you have ankle swelling plus several of these associated symptoms, the likelihood of a cardiac cause increases substantially. Third, consider your risk factors. Heart failure doesn't usually appear out of nowhere. It typically develops in people who have conditions that stress or damage the heart over time. High blood pressure is the leading cause of heart failure. Years of pumping against elevated pressure gradually weakens the heart muscle. Coronary artery disease, blockages in the arteries that supply blood to the heart muscle itself, can damage the heart through heart attacks or through chronic inadequate blood supply. Diabetes damages blood vessels throughout the body, including those feeding the heart, and it contributes to heart failure risk through multiple mechanisms. Previous heart attack, Even one that seemed to recover completely can leave behind damaged heart tissue that makes failure more likely later. Heart valve problems force the heart to work harder and can eventually lead to failure. Arrhythmias, irregular heart rhythms, particularly atrial fibrillation, are associated with increased heart failure risk. Obesity puts extra stress on the heart and is associated with conditions that contribute to failure. If you have one or more of these risk factors and you develop new ankle swelling, cardiac causes should be seriously considered. Fourth, consider the trajectory. Is your swelling new? Is it getting worse over time? Has it progressed from just the ankles to higher up the legs? Progressive worsening is concerning for heart failure or other serious conditions. Stable, mild swelling that hasn't changed in years is less concerning, though it should still be properly evaluated if it hasn't been. Let me tell you about another person whose story shows how paying attention to these details can make a crucial difference. She was 74 years old. She'd had high blood pressure for about 15 years, reasonably well controlled with medication. She'd also been diagnosed with type 2 diabetes about 8 years earlier, which she managed with oral medication and dietary modifications. She noticed her ankles starting to swell about 3 months before she came to see me. At first it was subtle, just a little puffiness in the evening. But over those 3 months, it had definitely gotten worse. Now her feet were swollen too, and the swelling was extending up toward her calves. Her shoes barely fit by the end of the day. She also noticed she was getting tired more easily. She'd always been active, walking regularly, doing housework, keeping busy. But lately she was needing to rest more often. Tasks that used to be easy now wore her out. Her primary care doctor had attributed the swelling to her blood pressure medication, a calcium channel blocker that she'd actually been taking for years without this problem. He'd also mentioned that some degree of swelling was normal with aging. But she wasn't satisfied with these explanations. The swelling was new. It was getting worse. And she felt different, more tired, more easily winded. Something wasn't right. She sought a second opinion, which is how she ended up in my office. When I examined her, I found what I expected to find based on her history. Significant pitting edema of both lower legs, extending to mid-calf. Her jugular veins were distended, a sign of elevated pressure in the venous system. When I listened to her lungs, I heard subtle crackles at the bases, suggesting some fluid accumulation. Her heart sounds were abnormal, with a third heart sound that's characteristic of heart failure. I ordered tests that confirmed the diagnosis. Her echocardiogram, an ultrasound of her heart, showed that her left ventricle, the main pumping chamber, was enlarged and not contracting as forcefully as it should. Her ejection fraction, a measure of how much blood the heart pumps out with each beat, was significantly reduced. She had heart failure. Not so advanced that she was having acute crises, but definitely present and definitely responsible for her symptoms. The good news was that we caught it before she had a serious episode. Before she ended up in the emergency room, unable to breathe. Before her heart deteriorated further. We started treatment with medications specifically designed for heart failure. These drugs can help the weakened heart pump more effectively and can slow or even partially reverse the disease progression if started early enough. We adjusted her other medications. The calcium channel blocker that her previous doctor blamed for her swelling was actually not an ideal choice for someone with heart failure, so we switched to a different blood pressure medication that's better suited to this condition. We discussed lifestyle modifications, particularly careful attention to sodium intake and daily weight monitoring to catch fluid accumulation early. Over the following months, her condition improved. The ankle swelling decreased substantially. Her energy improved. She was able to return to her normal activities. She still has heart failure. It's a chronic condition that requires ongoing management. But because we caught it early, because she paid attention to the warning signs and sought evaluation when the first explanations didn't seem right, she's doing well. Her heart function has actually improved with treatment. Her prognosis is far better than it would have been if she'd waited until she was in crisis. Her story illustrates something important. Trust your instincts. If something seems wrong with your body, if symptoms are new or worsening, if explanations don't seem to fit, push for answers. Seek second opinions. Advocate for yourself. Ankle swelling might be just a minor inconvenience caused by medication or prolonged sitting, but it might be your heart telling you it needs help. The only way to know is to get properly evaluated. Now let me explain what proper evaluation looks like so you know what to expect and can ensure you're getting thorough care. When you see a doctor about ankle swelling, the evaluation should include several components. First, a detailed history. Your doctor should ask about when the swelling started, whether it's gotten worse over time, what makes it better or worse, and whether you have any associated symptoms. They should ask about your medical history, particularly conditions that affect the heart. They should review your medications looking for drugs that can cause edema. Second, a physical examination. Your doctor should examine your legs to assess the extent and character of the swelling. They should listen to your heart and lungs for abnormal sounds. They should check your neck veins for distension. They should look for other signs of fluid accumulation. Third, basic laboratory tests. Blood tests can assess kidney function, liver function, thyroid function, and other parameters that might contribute to swelling. A test called BNP or NT-proBNP is particularly useful. This measures a hormone released by the heart when it's under stress. Elevated levels suggest cardiac causes of symptoms. Fourth, an electrocardiogram. This simple test records the electrical activity of your heart and can show evidence of previous heart attacks, rhythm abnormalities, and other cardiac problems. Fifth, if cardiac causes are suspected, an echocardiogram. This ultrasound examination of the heart shows how well your heart is pumping, whether the chambers are enlarged, whether the valves are functioning properly, and other important structural and functional information. Additional tests may be needed depending on what these initial evaluations show, but this basic workup should be done for anyone with significant unexplained ankle swelling, especially if they have risk factors for heart disease or associated symptoms suggesting cardiac involvement. If your doctor has not done this kind of evaluation and has simply attributed your swelling to aging or medication, you should ask for more thorough assessment, particularly if your swelling is new, worsening, or accompanied by other symptoms. Let me discuss what happens if evaluation does reveal heart failure. First, understand that heart failure is not an immediate death sentence. The term sounds terrifying, and understandably so. But heart failure simply means the heart isn't pumping as effectively as it should. It exists on a spectrum from mild to severe. Many people with heart failure live for years or even decades with proper treatment. The key is early diagnosis and appropriate management. Medications are the cornerstone of heart failure treatment. Several drug classes have been proven to improve symptoms, slow disease progression, and extend life in heart failure patients. ACE inhibitors and ARBs help relax blood vessels and reduce the workload on the heart. They've been shown to improve survival in heart failure. Beta blockers slow the heart rate and reduce the heart's workload. Despite seeming counterintuitive to give a drug that slows the heart to someone whose heart is already weak, beta blockers have proven benefits in heart failure when used appropriately. Mineralocorticoid receptor antagonists like spironolactone help eliminate excess fluid while also having direct beneficial effects on the heart. Newer medications like sacubitril/valsartan and SGLT2 inhibitors have shown impressive benefits in recent years and are increasingly used in heart failure treatment. Diuretics help eliminate excess fluid and reduce swelling and breathlessness. They're essential for controlling symptoms, though they don't by themselves improve long-term outcomes. The specific medication regimen depends on the type and severity of heart failure and on individual patient factors. Treatment is usually started cautiously and adjusted over time based on response. Beyond medications, lifestyle modifications are crucial. Sodium restriction helps prevent fluid retention. Most heart failure patients are advised to limit sodium to about 1,500 to 2,000 milligrams daily, significantly less than the average American consumes. Daily weight monitoring allows early detection of fluid accumulation. Patients are typically told to weigh themselves every morning and report significant increases, usually more than 2 or 3 pounds in a day or 5 pounds in a week, to their healthcare team. Fluid restriction may be needed in advanced cases. though this isn't required for everyone with heart failure. Regular physical activity, appropriately tailored to capacity, actually helps heart failure patients. The old advice to rest and avoid exertion has been replaced by recognition that carefully structured exercise improves function and quality of life. Smoking cessation is essential for anyone with heart disease. Alcohol should be limited or avoided. Close medical follow-up allows monitoring of disease status and adjustment of treatment as needed. For some patients with specific types of heart failure, devices like implantable defibrillators or cardiac resynchronization therapy pacemakers can provide additional benefit. In advanced cases that don't respond adequately to other treatments, heart transplantation or mechanical heart pumps may be options for suitable candidates. The point is that heart failure is treatable, it's manageable, and the earlier it's caught, the better the outcomes tend to be. This is why recognizing ankle swelling as a potential warning sign matters so much. Early diagnosis means earlier treatment. Earlier treatment means better preservation of heart function. Better preservation of heart function means longer life and better quality of life. Now let me address some common questions and concerns. Some people ask whether they should worry about any amount of ankle swelling or only significant swelling. The answer depends on context. Mild, transient swelling after a long day of standing, a long flight, or a salty meal is common and usually not concerning in an otherwise healthy person. Swelling that goes away quickly with elevation and doesn't recur regularly is less worrisome. But new swelling that persists, swelling that's getting worse over time, swelling that doesn't fully resolve overnight, or swelling accompanied by other symptoms deserves medical evaluation regardless of how mild it might seem. Some people ask whether they can just take a diuretic or water pill to address the swelling without getting a full evaluation. This is a dangerous approach. Diuretics can relieve swelling regardless of its cause. Taking a diuretic might make your ankles look better while an underlying heart problem continues to worsen undetected. The symptomatic improvement could delay diagnosis and treatment of a serious condition. Additionally, diuretics have their own risks and side effects. Using them without medical supervision can cause electrolyte imbalances, dehydration, kidney problems, and other complications. If you have ankle swelling, the right approach is proper evaluation to determine the cause, followed by appropriate treatment based on the diagnosis. Don't try to treat the symptom while ignoring what's causing it. Some people ask whether supplements or natural remedies can help with ankle swelling from heart problems. The honest answer is that if your ankle swelling is caused by heart failure, you need proper medical treatment. No supplement or natural remedy has been proven to effectively treat heart failure. Relying on unproven approaches while avoiding evidence-based treatment is dangerous. That said, some supplements might have supportive roles alongside conventional treatment. Coenzyme Q10 has some evidence for benefit in heart failure, though the data isn't strong enough for it to be considered standard treatment. Omega-3 fatty acids may have modest benefits for cardiovascular health, but these should be considered additions to, not replacements for, proven medical therapy. Some people ask how quickly they need to be evaluated if they notice ankle swelling. If you have ankle swelling along with severe shortness of breath, chest pain, or other acute symptoms, you need emergency evaluation immediately. These could indicate a cardiac crisis requiring urgent treatment. If you have ankle swelling that's new or worsening along with milder associated symptoms like gradually increasing fatigue or breathlessness with exertion, you should be evaluated soon, within days ideally, not weeks or months. If you have mild, stable ankle swelling without associated symptoms, you have more time but should still bring it up at your next medical appointment and request appropriate evaluation. When in doubt, err on the side of being evaluated sooner. The consequences of delayed diagnosis of heart failure far outweigh the inconvenience of a medical visit that might turn out to be unnecessary. Some people ask whether heart failure can be reversed once it develops. It depends on the cause and how far it's progressed. Some types of heart failure are partially reversible with appropriate treatment. If heart failure is caused by uncontrolled high blood pressure, getting the blood pressure under control can allow the heart to recover some function. If it's caused by a heart rhythm problem, correcting the rhythm can lead to improvement. If it's caused by a valve problem, fixing the valve can help the heart recover. Even in cases where the underlying cause isn't fully reversible, optimal medical treatment can sometimes improve heart function over time. Some patients who start with significantly reduced pumping function show improvement after months of appropriate therapy. However, heart failure is generally a chronic condition that requires ongoing management. Even when function improves, the underlying vulnerability remains. Continued treatment and monitoring are essential. The earlier treatment starts, the better the chance of improvement or stabilization. This is another reason why early detection through recognition of warning signs like ankle swelling is so important. Let me tell you one more story to illustrate the difference early detection can make. Two friends, both in their early 70s, developed ankle swelling around the same time. The first man mentioned his swelling to his wife, who urged him to see the doctor. He made an appointment and was evaluated thoroughly. Blood tests showed mildly elevated BNP. An echocardiogram showed early signs of heart failure with modestly reduced pumping function. Treatment was started promptly with appropriate medications. Over the following months, his swelling resolved almost completely. His energy remained good. A follow-up echocardiogram showed his heart function had actually improved with treatment. He continued to feel well and remained active. The second man noticed his swelling, but didn't think much of it. He figured it was just aging. He didn't mention it to his doctor because it didn't seem important. He adapted by buying wider shoes and figured that was good enough. Over the following year, his swelling gradually worsened. He became more tired. He started getting winded climbing stairs. He began sleeping in his recliner because lying flat made him uncomfortable. He attributed all of this to getting older. Then one night, he woke up gasping for air, unable to breathe, coughing up pink frothy fluid. His wife called emergency services. He was rushed to the hospital in acute pulmonary edema, his lungs full of fluid from severely decompensated heart failure. He survived, but just barely. His heart function was severely reduced. He spent a week in the hospital. He was discharged on multiple medications, but remained significantly limited. He couldn't walk more than a short distance without stopping to rest. He required supplemental oxygen at times. His quality of life was dramatically diminished. Same starting point. Ankle swelling in two men of similar age. Completely different outcomes. The first man paid attention to the warning sign. He got evaluated. He started treatment early. His heart function was preserved. The second man ignored the warning sign. He delayed evaluation. His heart continued to deteriorate until it nearly killed him. By the time he finally got treatment, significant damage had occurred that couldn't be undone. The difference was simply recognizing that ankle swelling might be important and acting on that recognition. I'm sharing these stories because I want you to understand that this information isn't abstract or theoretical. It's practical and potentially life-saving. The patterns I'm describing play out in real people's lives every day. Now let me give you a clear action plan based on everything we've discussed. If you currently have ankle swelling, here's what you should do. First, assess the swelling carefully. Is it in both legs or just one? How far up does it extend? Does it pit when you press on it? Does it improve overnight? How long has it been present? Is it getting worse over time? Second, assess for associated symptoms. Are you more tired than usual? Do you get short of breath more easily than before? Do you need to sleep propped up? Do you wake up at night breathless? Have you gained weight recently? Has your appetite decreased? Do you urinate more frequently at night? Third, consider your risk factors. Do you have high blood pressure, diabetes, coronary artery disease, previous heart attack, heart valve problems, or a family history of heart disease? Fourth, seek medical evaluation. Make an appointment with your doctor and specifically mention the ankle swelling and any associated symptoms. Request thorough evaluation, including appropriate blood tests and likely an echocardiogram if cardiac causes are suspected. If your doctor dismisses your concerns without adequate evaluation, advocate for yourself. Ask specifically why heart failure isn't being considered. Ask for the tests that would rule it out. If you're not satisfied with the response, seek a second opinion. Fifth, if you have ankle swelling along with severe breathlessness, chest pain, or other acute symptoms, don't wait for an appointment. Seek emergency care immediately. If you don't currently have ankle swelling but are at risk for heart disease, here's what you should do. Be aware that ankle swelling can be an early warning sign of heart problems. If you develop new swelling, take it seriously and get evaluated rather than assuming it's just aging. Manage your risk factors aggressively. Keep your blood pressure well controlled. Keep your diabetes well controlled if you have it. Don't smoke. Maintain a healthy weight. Stay physically active. Eat a heart-healthy diet. Have regular medical checkups and discuss any new symptoms promptly with your healthcare provider. If you have a family member or friend who has ankle swelling, share this information with them. Encourage them to get evaluated if they haven't been. Sometimes an outside perspective can motivate someone to take action they've been putting off. Let me leave you with some final thoughts. Your body is constantly communicating with you. It sends signals when something is wrong. Ankle swelling is one of those signals. It might mean nothing serious, or it might mean your heart is struggling and needs help. The tragedy is when these signals are ignored, dismissed, or attributed to aging without proper investigation. The tragedy is when treatable conditions go untreated because warning signs weren't taken seriously. The tragedy is when people end up in crisis situations that could have been prevented with earlier intervention. Don't let that be your story. If you have ankle swelling, find out why. Don't accept aging as an explanation without evidence that aging is actually the cause. Get the tests. Get the diagnosis. Get appropriate treatment if it's needed. Your heart works tirelessly for you every moment of your life. When it sends you a signal that it's struggling, listen to that signal. Pay attention. Take action. This could be the information that saves your life. Or it could be information that seems irrelevant to your current situation, but becomes vitally important months or years from now when you or someone you love develops symptoms that need to be recognized. Either way, you now know something important that many people don't know. You know that swollen ankles aren't just aging. You know they can be a warning sign of heart failure. You know what to do about it. Use that knowledge. Thank you for watching this entire video. I know it covered a lot of ground, but this information is too important to abbreviate. If you found this valuable, please share it with others who might benefit. Friends, family, anyone who might have ankle swelling or might develop it in the future. You could literally save someone's life by sharing this information. Subscribe to this channel for more content about health issues that affect older adults. I try to provide detailed, evidence-based information that can help you take better care of yourself and the people you love. Leave a comment below letting me know if you've experienced ankle swelling and whether you've had it evaluated. Your experience might help someone else who's watching and wondering whether their symptoms are significant. Take care of yourself. Pay attention to what your body is telling you. And remember, swollen ankles aren't just aging. They might be your heart asking for help.